Hey y'all, welcome back. I had a question about biopsies. Now, I can't really explain everything about the biopsy, but as a CT tech, what we need to have prepared for the procedure are a few things. And most importantly, here is the tray. The tray is what the radiologist is going to use. Everything is in here for them to use. So the needles, some tubes. This one already has a chloral prep. So some trays do not have a chloral prep, but this one already has one inside. So technically we don't need it, but just so you can see, this is a chloral prep. Again, there's one inside here already. What else do we need? So there's needles and other things in here that you need. So this always remains sterile. So when you use this, just make sure you open it in a sterile procedure, a sterile way. When the radiologist uses this, they have sterile gloves. And here are a few types of sterile gloves that we use. And everyone's different, just know everyone's size. That's very important for the radiologist. If you know their size, just have it out for them. Okay. So once we get the ruler, they'll tell you from the lateral or medial side 2 centimeters or whatever. So you'll just measure it like 2 centimeters or 5 centimeters. If you're really off, 10 centimeters, whatever it is, because you can measure it on the machine. Another thing we have to put on the tray for the radiologist, and that stays sterile, is a UE needle. A UE needle is also called a centesis catheter. And this is the pretty much initial needle that goes in. So they're both 5 French, and there's different sizes, but 5 French is the main thing. And this is a longer. You see how it's 15 centimeters? And this is 10 centimeters. So that's the difference. See how long? So if you're going through thicker anatomy or a thicker mass, then you'll go with the longer one, and then this is a shorter one. So we'll have this for them. So this is the initial main needle that goes in after the lidocaine. And then after they get the location with the UE needle, then you would have the biopsy needle. This stays sterile as well. Once you open it, it stays sterile. So each biopsy needle is also different. So depending on what the radiologist wants or needs, they'll tell you 18 gauge by 16 centimeters. So 18 gauge is the bore and 16 centimeters is right there. And they'll tell you other stuff. So there's different ones like 20 by 16 or 18 by 10. Just depends on what they want. So they'll tell you. So once they get the biopsy, they'll get to the location, they'll mark it, blah 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 blah. It might take a few times to get there. Once they're right at the location, they'll click it, and then it gets a core biopsy. So it'll be like a little string, kind of like a worm. And once they get that, then they'll put it in formalin. So have the formalin out, and this is just formalin. So once the formalin's here, you have to open the cap. It stays open, and then they'll just put the biopsy that they get into here, and then you'll have to wrap this up, seal it really well. They get about normally 3 samples, and then you put it on a fire hazard bag, and then once everything is done, then they pull the needles out, and then all we have to do is put a border gauze, or the tray also comes with a band-aid. So once it's done, you put a band-aid on and call it a day, and hopefully the nurse is there, everything's fine, vitals are good, and the patient gets to roll out of the room, and that's how a biopsy essentially goes. All right, that's it. Toodles, noodles.